Hi everyone, this is Dr. Serge, the nutrition scientist. Today I wanted to talk about one specific topic, which is, as you can see on the screen, what is the consequence of removing tonsils and adenoids in kids. It has been a really common practice for the last several decades that if a child has recurrent ear infections or gets sick irregularly, the doctor will just simply remove the tonsils and adenoid in order for them to get better. But we know today from quite a bit of research that this practice has quite a bit of consequences and side effects when those kids get older. And I wanted to cover a few things today when it comes to this practice, which has drastic side effects on health. So as we can see on the screen is every year more than 100,000 kids get their tonsils removed. And we know today by doing this that if you don't have your tonsils or when they remove them, you have 3 times the risk factor of having upper respiratory issues, okay, like getting a cold or asthma, and etc., as we can see here. So usually, as a short-term benefit of removing these tonsils, kids will get better, but the long term is they tend to get sicker with, as we can see, like asthma, pneumonia, influenza, virus, flu, and COPD, which is a really chronic problems that develops in the 40s and 50s and 60s in people. Okay, and the other problems we can see is when they remove, for example, the adenoid, we can see there's a double risk of COPD. So removing the tonsils and adenoids leads to an increased risk of issues when it comes to the upper part of the body, like the eyes and the lungs and the sinuses, and etc. So, and we have found over the years that removing the tonsils, for example, lead to a 5-fold increased risk of inflammation of the middle ear. So it's kind of ironic that they remove the tonsils, for example, to help kids who have recurrent ear infections, but on the other side, those kids tend to have more ear problems along with sinus infection. The interesting word in this is really inflammation. We know today that the tonsils, for example, are part of the immune system. So when you start removing a part of the immune system, you can imagine that it will have side effects. And one of it is an increased risk of having inflammation in the body. So meaning that if you don't have your tonsils, over time, over years and decades, you have more inflammation going on into the body. And we know today that inflammation is the root cause of most issues that people have, like heart disease and cancer. As a matter of fact, we know today that people who do not have the tonsils have a much higher risk of having several types of cancer, like blood cancer or breast cancer. Okay, we know today, unfortunately, that tonsils is one of the tools that the body has to actually fight inflammation, which fights cancer. Okay, so this practice should be abandoned. We shouldn't remove tonsils in kids anymore. We should help them to build up the immune system by providing a better diet to them. So thank you all for watching. God bless you.